So when you look at a child from infancy to school age, think of the amount of growth and development. It's really vast. A lot happens in the human body in those years, and Dr. Julie Johnson from the Palmer Chiropractic Clinics is here to show how chiropractic can help through those different phases. In my baby book, my mom wrote, at age 3 months, I had my first adjustment.
Oh, that's fantastic.
Isn't that something?
Yes.
A child of chiropractic. Hey, look at me now. Okay, it was that coffee, I'm sorry. Dr. Julie, is this something that you're a doctor of chiropractic yourself. Have you adjusted children as well?
I have adjusted children as well, absolutely. But I have not gone through the Diplomate program as Dr. Sherry Marriott has. She's had additional specialty training in adjusting children. That's
the video we're going to look at now. And you said she's adjusted newborns. I mean, right into the world, right?
Absolutely, absolutely.
And you're going to see that this child is quite young. She's adjusting hair. It looks like a little gal who's probably under a year.
Absolutely. She was under a year. I believe she was around 9 months old.
Okay, and look at her, how much she loves it. Let's talk about this. Why have this done with a baby?
Well, there are several reasons that parents choose to have their babies adjusted. There may be difficulty in nursing. There may be issues with constipation, with colic. All sorts of things can happen right from day one. So parents, of course, want to make sure that their children are as structurally and functionally sound as possible.
So it's a very light touch, as you can see Dr. Marriott doing there. It's not, it's not the it's not a strong arm at all.
No, not at all. It's very gentle. The way that we liken it is to the way that you would take a tomato and test for its ripeness. It's about the weight of a nickel.
Oh, really? Oh, you brought a tomato just to show us. Just so, but you're talking about the pressure would just be that of the way you would pick up a tomato.
It is. A lot of people don't realize how gentle chiropractic care for children can be.
Well, the little baby girl was playing with this doggy in the video. Show us what that does.
Well, this is called an adjusted puppy, and really when you click on its back, it makes a sound.
It makes a little sound. Let's see if we can hear the sound.
I'll click it again.
A little click. And so you do that to show the child what's going to happen?
We do. We want them to be as comfortable as they can possibly be. It's also a tool, really to educate parents as well. When they come in with their children, Dr. Marriott was telling me that she's suggested, Barbie dolls. They bring in their favorite toys and so forth. It's just really about making that child as comfortable as they can be.
And then older kids, I would like to hear the explanation to adjust school-age kids with their heavy backpacks and kids who are in sports.
Well, you've named it really. When children get into school, the expectation with those backpacks is a tremendous weight on their spine. Also, they're sitting in a desk for many, many hours a day, studying, having to pay attention, and then the sports aspect. You've got soccer, you've got football, you've got so many traumas to the body that it's really important to continue to make sure that they, again, have the best structure that they can as they grow.
Well, Dr. Marriott, who just happens to be kind of right next door here to the station at the clinics, this is a specialty of hers.
It is. She was part of the first class to graduate with a diplomate from the International Council on Chiropractic Pediatrics. And she's been working with children specifically for over 25 years.
Wow. It's good to see. It really is a wonderful alternative. So it's great to have you here, Dr. Julie.
Thank you.
Thank you so much. Thanks for all the great information.